Good afternoon. Welcome to the Thailand Conference on Public Health. Thailand is a middle-income country that has been developed over the past few decades. In the process of developing, it has transitioned from communicable to predominantly non-communicable burden of disease. Currently, statistics show that the top causes of death are cancer, heart disease, and road injuries. The three public health issues that correlate to the top causes of death that need to be addressed immediately are tobacco, cardiovascular disease, and road injuries. Today, we have four speakers from the Ministry of Public Health in Thailand that are here to further explain these issues.
Thailand is currently facing cancer as a leading cause of death, and lung cancer is being one of the top 10 causes of premature mortality. As research shows, the main cause of lung cancer is tobacco. Tobacco is the number one risk factor that drives both deaths and disabilities for all ages in 2016, and has seen an increase since 2005 of 6.7%. The World Health Organization states the highest smoking rate in Thailand is in moderately poor or in the second quintile group. Also, the Tobacco Atlas reports that 20.1% more boys smoke in Thailand than on average in middle-income countries. This indicates that the poor population and young boys are at the most vulnerable population that needs to be targeted. Over the past 2 decades, there has been measures implemented to control consumption of tobacco use, which has caused a gradual decrease in smoking rates. However, there is need for stricter rules that prevent children from smoking. There should be laws that enforce adults from smoking near or around their children. Also, cigarettes should have their prices increased even further so it's more at a range for the highest smoking population, which are the poorest people in Thailand. Finally, there should be more funds given to enforcement of smoke-free environments and advertising that educates the population of risk of tobacco.
2011. As a result from epidemiological transition, the burden of diseases has evolved from high rates of communicable diseases to high rates of non-communicable diseases. One of the main public health issues we have found in Thailand are chronic diseases including type 2 diabetes and cardiovascular diseases, specifically ischemic and stroke. It is evident that the country's economic change leading to lifestyle enrichment has a direct correlation with type 2 diabetes, affecting morbidity. According to Health Group, which is shown in figure 2 right here, the most contributing dally for number one cause of burden of death is 13.9%, which is attributed to cardiovascular diseases. And if you look here, number 3, it's 9.9% for diabetes. That is a pretty high number, which is equivalent to around 4 million people in Thailand right now. Considering Thailand has recently transitioned into a higher-income country as a society, changing characteristics and habits of its population may be challenging, but yet it's not impossible. Examples include promoting healthier food options over fast food restaurants and the knowledge on general nutrition. Campaign funded by charity can be launched within cities to host community activities, including classroom sessions on negative effects of drug and alcohol use. Another approach could be posting billboard papers across the cities of busy streets to promote a overall efficient spread of information.
From this tree map shown here, in 2016, road injuries contribute 5.34% of the total deaths in Thailand, which is one of the top causes of death and disabilities. Despite comprehensive law enforcement, Thailand still has the world's second highest road fatality rate, with 73% of its road traffic deaths being motorcyclists. Research shows that the travel mode transition from motorcycles to cars can effectively reduce road traffic death. Hence, we strongly suggest the government to limit the use of motorcycles in high population density areas. The second recommendation we strongly urge for the government to take into consideration is to reduce the urban speed limit down to 50 km per hour, as suggested by the World Health Organization. This is proven to be a large-scale solution that can give promising results.
In conclusion, although Thailand is now classified as a middle-upper income country, they are still considered as a developing society at the population level. 3 public health issues that brought attention to our task force was cardiovascular disease and diabetes, road injuries, and tobacco. In fact, these issues are one of the highest burden of disease in Thailand. In order to provide a better health status for the community, we have developed an action plan for each category. This includes education programs, activities, promotion events, and recommendations to the Thai government on specific laws that can be used to control tobacco usage, for example. As a task force for the Ministry of Health, we strive to tailor interventions methods towards different groups to produce an effective and efficient result, as well as maintaining equality and equity.